Welcome to the training module for mandatory communicable disease reporting in Cuyahoga County, Ohio. Approximate time to complete this training is 15 minutes. This training module is intended for healthcare providers, physicians, hospitals, infection preventionists, laboratorians, and public health system partners to provide key information on the requirements associated with mandatory communicable disease reporting. It is very important that healthcare providers do not rely on diseases being reported by laboratories, as things can get missed. Making sure all communicable diseases are properly reported must be a team effort. The objectives of this training are twofold: to describe the process associated with mandatory communicable disease reporting in Cuyahoga County, Ohio, and to provide links to useful resources for mandatory communicable disease reporting. We will reference certain documents throughout the training. Links to those documents will be provided at the end of the module for your reference. Content for this training module was developed from the Ohio Department of Health's Infectious Disease Control Manual, the IDCM. A link to this manual can be found at the end of the training module. Let's start with discussing why communicable diseases should be reported. There are 3 reasons why communicable diseases should be reported. First, for disease control and prevention. Second, for surveillance. And third, for identification of outbreaks. When diseases are reported, epidemiologists can track patterns and outbreaks of diseases in order to prevent and/or contain them. For these reasons, it is part of state law to report communicable diseases. So who is mandatory communicable disease reporting for? Healthcare providers, which includes physicians, hospitals, infection preventionists, with knowledge of a case or suspect case of a disease which is required to be reported. Laboratorians, that examine specimens of human origin with evidence of diseases which are required to be reported, and any individual having knowledge of a person suffering from a disease suspected of being communicable. It takes a team to protect the health and well-being of the public. Sharing of information is critical for the success of an outbreak investigation. As we begin this discussion, we wanted to answer a question that may be on some of your minds. Can sharing health information about patients with public health officials be considered a violation of HIPAA? The following information is taken from the Health and Human Services website, which details a thorough explanation for the rules regarding disclosures for public health activities. It states that, quote, "The HIPAA privacy rule recognizes the legitimate need for public health authorities and others responsible for ensuring public health and safety to have access to protected health information to carry out their public health mission. The privacy rule permits covered entities to disclose protected health information without authorization to public health authorities who are legally authorized to receive such reports for the purposes of preventing or controlling disease, injury, or disability. This would include, for example, the reporting of a disease or injury, reporting vital events such as births or deaths, and conducting public health surveillance, investigations, or interventions. For further information, please refer to 45 CFR 164.512b. We will now begin to discuss how someone can determine whether a disease needs to be reported. Diseases and outbreaks are divided up into groups, called classes, based on their severity or epidemic potential, such as the ability to easily be spread to others. Class A diseases are of major public health concern because of the severity of disease or potential for epidemic spread. Some examples of Class A diseases are meningococcal disease, foodborne botulism, and measles. Class B diseases require timely reporting because of potential for epidemic spread. Some examples of Class B diseases are E. coli 015787, pertussis, and Lyme disease. Class C includes outbreaks, unusual incidents, or epidemics of other diseases, example histoplasmosis, scabies, staphylococcal infections, and pediculosis. Includes outbreaks that may be community, foodborne, or waterborne. Generally, a case's residence determines where the report needs to be sent. If the case resides outside of Cuyahoga County, please refer to the local health department for that county for details on how to report communicable diseases. It is important to know that in Cuyahoga County, reporting is centralized based on type of disease. If the case resides in Cuyahoga County, then the following guidelines will apply. Certain diseases, though, have their own guidelines for reporting. We will cover those in the upcoming slides, beginning with AIDS. All Cuyahoga County resident AIDS cases should be reported to the Office of Communicable Disease Surveillance and Epidemiology at the Cleveland Department of Public Health, Attention Benos and Durham, by mail at 75 Erie View Plaza, 3rd floor, Cleveland, Ohio, 44114-1839, or by fax at 216-664-6159. All Cuyahoga County resident HIV, syphilis, and all other reportable STD cases should be reported to the J. Glenn Smith Health Center at the Cleveland Department of Public Health, by mail, attention DIS STD Unit, 11100 St. Clair Avenue, Cleveland, Ohio 44108, or by fax at 216-420-7712, or by phone at 216-664-7099. All Cuyahoga County resident suspect and identified tuberculosis cases should be reported to the Metro Health TB Clinic. To phone number 216-778-8083, or by fax at 216-778-3710. For all other reportable communicable diseases, report all suspect and identified Cuyahoga County resident cases to the central reporting at the Cuyahoga County Board of Health. To phone number 216-201-2080 during normal business hours, or 216-857-1433 after normal business hours, or by fax at 216-676-1316. We've discussed where to report diseases when the residence of the case is known. However, before we move on, we'd like to present some brief guidelines on what should be done if the residence of the case is not known, or if residence is outside of Ohio. If residence is unknown, report to the local health jurisdiction in which the healthcare provider or laboratory is located. If residence is outside of Ohio and reporting via electronic laboratory reporting, ELR, report to the state of case's residence. If residence is outside of Ohio and not reporting via ELR, report to the local health jurisdiction in which the healthcare provider or laboratory is located. We'll now go over what information needs to be included in a report. Note that what needs to be reported varies depending on whether you are a healthcare provider or laboratorian. The following information needs to be included in a case or suspect case report when it is made by a healthcare provider. Name of case or suspect case, date of birth of case or suspect case, sex of case or suspect case, contact information including telephone number and street address including city, state, and zip code, healthcare provider's own name, number, and street address, any supplemental surveillance information for the specific disease being reported, and diagnosis or suspected diagnosis. It is also helpful to include positive lab results if lab testing has been done, clinical symptoms including date of onset, and vaccine history if reporting a vaccine-preventable disease. The following information needs to be included in a case or suspect case report when made by a laboratorian. Name of case or suspect case, date of birth, sex of case or suspect case, street address including city, state, and zip code, healthcare provider's name, number, and street address including city, state, and zip code, and laboratory test information including specimen identification number, specimen collection date, specimen type, test name, test result, and organism and serotype as applicable. Depending on the disease, additional information may be required. This information can be found in Section 3 of the Infectious Disease Manual. Section 3 includes links to detailed information regarding specific diseases, including epidemiology, diagnosis, and public health management. We've included the link to the entire Infectious Disease Control Manual from the Ohio Department of Health. Now we will discuss how and when a report is made. How a disease is reported depends on who is making the report. When a disease is reported is the same for all reporters and depends on the group, referred to as the disease class. For healthcare providers, the following procedures apply. Class A diseases must be reported immediately by phone to the Cuyahoga County Board of Health at 216-201-2080. This should be followed up by submitting Form HEA 3334 or supplemental forms as advised by the Cuyahoga County Board of Health. Follow-up reports may also be made electronically via the Ohio Disease Reporting System, ODRS. We will discuss how to do this in a couple of slides. Class B and C diseases must be reported by the end of the next business day by submitting HEA 3334, in addition to any pertinent supplemental forms as appropriate. Class B and C disease reports may also be submitted electronically via ODRS. For laboratorians, the following procedures apply. Class A diseases must be reported by phone immediately upon knowledge of a positive laboratory result to the Cuyahoga County Board of Health at 216-201-2080. This should be followed up by submitting Form HEA 3333 as advised by the Cuyahoga County Board of Health. Follow-up reports may also be made electronically via the Ohio Disease Reporting System, ODRS, or through electronic laboratory reporting, ELR. Class B and C diseases must be reported by the end of the next business day by submitting HEA 3333 or electronically via ODRS or ELR. Perhaps you're wondering how diseases can be reported electronically. The Ohio Department of Health administers a web-based system that can be used by infection preventionists, healthcare providers, and laboratories. The system is called the Ohio Disease Reporting System, or ODRS. Per the IDCM manual, if a provider is reporting more than 200 Class A, B, or C diseases a year, reporting via ODRS should be considered. ODRS can be used for follow-up reports for Class A diseases and Class B and C initial reports. To become an ODRS user, healthcare providers, labs, or IPs should contact their local health department as they will arrange setting up an account and training for you. Some information is provided here for troubleshooting ODRS. Hospitals and laboratories can use electronic laboratory reporting, ELR, for the reporting of mandatory communicable diseases. Note, positive results of Class A diseases must still be reported by phone. The IDCM recommends ELR reporting for laboratories that report 200 or more Class A, B, or C diseases yearly. You may contact the Ohio Department of Health at elr@odh.ohio.gov to discuss whether ELR would be suitable for your facility. Here we have links to all the resources mentioned throughout the training. Thank you for taking the time to listen to this training module on the mandatory reporting guidelines for communicable diseases. If you have any questions regarding reporting guidelines or this training module, or have suggestions on how this module may be improved, please call 216-201-2080.